Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Thank you so much for joining us today. Welcome back to Between Two White Coats. And Amber and I are super excited because today we have a friend with us, Dr. Sammy Chang. Sammy, tell us a little bit about yourself.
Name's Sammy Chang. I live here in Oconee. I am a recovering ED doctor. Went into emergency medicine, probably 12 years ago. So residency for 3 in Charlotte, and then took a job in Athens with a private group who's been awesome. But I'm entering year 10 and realized that I needed to make a change. Got 3 young kids and a beautiful wife and a good family, and the health of my family was the most important thing to me. Let's see.
What do you like to do for fun? We'll do the fun stuff, then we'll go back to the...
Okay, so personally for fun, my hobbies are in the outdoors, fly fishing, hunting. I co-own a outdoor magazine.
You do what with an outdoor magazine?
I co-own it. I'm the
You
photo editor.
cool! I didn't know that.
I know, you have to become a subscriber.
I know. I mean,
Please.
I know nothing about fishing. I don't even take them off the hook when I would fish with my grandfather when I was younger. But hey, that sounds so cool.
That is
Yeah.
awesome.
So that is honestly my life. That's actually how I ended up in emergency medicine. My backstory into medicine is pretty long. I actually was an Air Force ROTC at Georgia Tech. I thought I wanted to fly, had several lung collapses from senior in high school into freshman year of college. So I got medically discharged and kind of left without a plan. But while I was in the hospital, I thought that the thoracic surgeon who took care of me, I just thought it was neat. And so I shadowed him, took an extra year at Tech, got my pre-med stuff, went to medical school. And then as I was choosing a specialty, I was trying to decide between surgery and emergency medicine. And to my surgical colleagues, not to make fun of you, but at the interviews, they were wearing bow ties and talking about research. And I quickly realized that's not what I wanted. And all the emergency medicine applicants, wearing flannel and talking about anything but medicine. So I knew those were my people. The schedule when you're single or engaged but no kids is awesome because you don't work. You can have days off during the week to go to the outdoors and you have less people around you. So I kind of made a decision based on that and thinking emergency medicine was, I can take care of anything at any time. But I continue to pursue the outdoor stuff. With 3 young kids, it's not as easy. So when I can, I go fly fishing during hunting season. I try to hunt. I was fishing yesterday on the Chattahoochee, which was very
Alan
good.
Jackson song.
Yes.
That is awesome.
Yes.
So today's topic is burnout. And so we want to start a little bit. We've invited Sammy here because, as he's already alluded to in his introduction, he himself is experiencing what happens when you realize, how do you realize, and what happens when you realize that you may be burnout in your career. Specifically for people like physicians where the bridge to your career is not a short one. And so we think this is a really important topic because it's a topic that hits our field a lot. So I want to start by talking about what is burnout, and then we'll keep pulling in and hearing more from Sammy's story on how people can recognize, and hopefully we'll be able to give some value to people who may be struggling with this. And it is a lot of people who in some degree or another are suffering with some burnout. So I in my research for this came across something that I thought made great sense from a science perspective. that burnout frequently is when we can never finish our stress cycle. There was a great, fight or flight analogy of like you're running from the bear. Our bodies have not evolved to change how our norepinephrine and epinephrine from the time that we were cave people. So if we're running from a bear and we get to safety, we have all the norepinephrine, epinephrine, everything going. Terrible things are about to happen. All the stress hormones are high. And then you get to safety and you go, okay, I'm going to live. And then those stress hormones cycle through and kind of get out of your system. And so when we were in that fight or flight, finish the fight or flight system, that worked very well for our bodies. What happens frequently now, specifically in the jobs that suffer a lot from burnout, are we never finish that fight or flight system. So we're running from the bear and then we never get to go, I'm going to live, it's all okay, and we just start running from the next bear. So like in the emergency room, you have someone come in and they are screaming at you because they had to wait too long. You're trying to get them to talk about why they're here today while they're continuing to be frustrated with the healthcare system. And so you feel a little bit under attack, but you walk out of that room or curtain and you go straight into, or you don't even get to choose to leave because you hear code blue. And so you go over a couple curtains over and you're now doing chest compressions on someone. Someone might die, you have to go tell a family, and then it's straight to the person with sinusitis. And never at any time do you get to have a moment of, okay, that was a horrible thing that I just had to do. And let me kind of finish feeling it or processing it and then move on. And I know there have been times thank goodness in outpatient medicine, I'm not programmed for that kind of emergency. I would burn out quick in that because I need to feel things and process things.
But even in the same token, like there have been days where I've just had to tell someone like, you have cancer. And then I go to the next room to do like a pediatric well check where we're doing all the fun stuff,
Absolutely.
So like you change from being like, I just gave someone the worst possible news, like the biggest thing, everybody's scared of the C word. And then I'm leaving that room and I'm going right to the next one. And we're talking about fun stuff. Like I love my pediatric well checks. Like
Yep.
They're a blast. But then I have just had this very sad, like, let me get you to the next step. So in a way, we do that as well. It just looks different.
It just looks different. And there are times I think and we work in a good group of people that support each other here. And there are times where we've had to do rescue measures on someone and get them into the ambulance and on. And I remember one time when we had a young person that we couldn't stop from seizing, and we don't have the kind of stuff here that an emergency department has. And I remember afterwards, you and Dr. Kirkland held hands and prayed and then went to the next room. And that just sort of was it was a lot.
I could get teary thinking about that.
We handed it to God because that's who we are. And we kind of had an exhale. And then we went on to the next room. Like 3 seconds is probably not enough time to process that. Yeah. However, it was at least 3 seconds to process. And in other environments, you don't have that.
Yeah. You don't have
that really spoke to me on this never finishing the fight or flight process, always just going to the next thing. I think that's one of the things that contributes to burnout. If we were to define, if you're listening to this and you're like, well, what actually is burnout? I think the fact that we're talking about things in reference to fires, it's all on fire, and I think like when you feel like everything's on fire, it's one fire and putting out, and we say things like we're in hustle culture. Everything has to be big and everything has to be now and everything has to be pushed. And so it's, people wake up and they're like, what fires am I putting out today? I remember when my husband worked in corporate America and his job was marketing for trying to get people to eat more Wendy's. He was, his firm helps with Wendy's and Miller Beer and these places that they're helping to sell more of that. And I was a resident at the time. We're old, so we all had pagers. And so none of our pagers are going off, but all these people who work in corporate America at 9 p.m. have their phones going off all night. And I was like, oh, is it another Wendy's emergency? Is it? And I'm like, yes. And they were laughing because they were like, we're not saving lives here. We're trying to get people to eat more fast food. And our phones are going off nonstop, but you doctors are getting fewer interruptions. But it's not always that you save lives. It's the stress that comes with your job, but it can be a perceived stress. It can be a stress from your employer. It can be that everyone has to be available at all times now. We've got the cell phones, and when we all went remote in the pandemic, it just, we can reach you at any time. So I don't think people really have an ability to stop work in many fields and then go home to their families or be in other places. That can really contribute to burnout. But I think the feeling of fullness, of overwhelmed, of unhappy, the idea dread is a huge one. The idea that going to the job is so dreadful.
Or going home is so dreadful. It can
that wherever it is that life is too overwhelming. And you just feel like you have to be on all the time, and you're tired and you don't know where to get help. Sammy, if you were helping someone, so if someone's listening and they're like, am I burnt out? What does burnout feel like? How would I know this? What are your thoughts on how you started recognizing what is burnout, or how did it present?
Yeah, I'm still processing how I came to this. I've been very black and white my whole life, and I realized pretty early on in residency I was already struggling with the frustrations of emergency medicine. All the things you alluded to, even in residency where you don't have quite as much responsibility, but it is go, go, go. The expectations are you're going to see more patients. Where I went to residency, we never wanted to let a patient hang who was ready to be seen. So you started to develop this, okay, there's a patient ready to be seen, click on them. Whether or not you've taken care of the other things, you're trying to see more to show your attendings you can do this. That carried over into when I became an attending. I didn't like seeing patients in the waiting room hanging, but I also I knew my workload was getting too much. So I guess for me, it was a recognition on multiple levels. So the first thing is, you all alluded to faith, but faith and family are the most important things to me. And having kids in my early career, so I have an 8-year-old, a 5-year-old, and a 3-year-old, but we basically had our first, within the first year or so that I was an attending here. It was hard to figure out if my frustration at work was all work related. And I guess I'm trying to figure out how I got to this point, but I think what I realized is I was getting increasingly angry at work, around, outside of work, driving, everything. I was just angry. And I did not want to bring that home. So I had to figure out how to overcome that so that I could be a present and joyful and graceful and patient father and husband. And for the most part, I feel like I did that. But it was a lot of work. And so I'm rambling, but I'm trying to figure out, it was a process over 9 years, and all my partners at my group, or my ex group now, I think they could tell you the writing, I wear my emotions on my sleeve. And so I would get very angry and throw toddler-like tantrums in the emergency department amongst them in a place where we were all working and nobody else could see.
So you're saying a lot of things that I think are really valuable. One, you've been asked to do something that is physically impossible. You must see more patients, but you must spend more valuable time with patients. You must be accurate and thorough while being fast. And I cannot. A completely is the opposite of B, and yet I'm supposed to do both. So you're already feeling I'm asked to do something that no one could succeed at.
Right.
You're a personality type, as a lot of fields that are prone to burnout. You're a personality type that wants to succeed. You've asked me to do A and you've asked me to do B, and I cannot do both, but I will. I will find a way, because I'm a person who succeeds and wants to do a good job and wants to impress that I can, and show myself and others that I can do this. I will overcome this challenge. even though the challenge is not capable of being overcome, because we're asking doctors to do impossible things. You cannot be fast and move all the people through and be thorough and save all the lives. And so we need to put more doctors in here. We need to create more space. But there is not more space and there is not more doctors. So we're just asking the doctors that are there to do an impossible challenge.
Yeah.
And you're smart and you know that it's impossible, but you're determined to try to do it. So there's a lot of frustration that comes with that.
Yeah.
You're mentioning your work-life balance. And when something that's and you mentioned what's most important to you. And I think that's also when you recognize that your job is making you compromise the things that are most important to you. That can't sit well. And so where do you put that? And that's a huge contributor to burnout. Bottom line, really, if your faith and your family are most important and your job makes you sacrifice how and who you are in your faith and family. When you start thinking, when you know God is good and all things about God are good, but you're walking out of work going, all people are horrible and I hate the world, how do you compromise those two things?
Right.
How can those coexist? So what you end up thinking is God must not be good. Maybe the whole world is not good because this all feels bad. And so you start, it's not cognitive. You're not sitting there thinking all this. You just know it's not adding up. Like
Right.
something inside you is unsettled because it's not adding up. And then you have to be someone different when you get home. You're in overdrive, fight or flight. I don't understand why I'm feeling this way, but I'm not happy. And then you got to get home and be loving, nurturing, caring dad. And how do you flip that switch? You can't just go in and take all of those stress hormones. And I think we also think that it's a mental decision. Like, I'm on my drive home going to remind myself that I love my children and wife and that I'm lucky to have them, and then I'll be a different person when I get home. But not if all of the fight or flight hormones are still in there and they haven't been processed.
Well, and one of the things you said too, like, your intention was to be a grace-filled patient. And so, like, that's the doctor you want to be too. You just
Right.
weren't able to be that.
Yeah.
No, that's a
And
good point.
so, like, for you to mention that, like, obviously you're brilliant. You went to tech. You went there. You said you took an additional year. Like, it's not that you're not an intelligent person, but you want to be grace-filled and patient. And that's the kind of physician you wanted to be in the ER, but you weren't given the opportunity to do that because of the whatever bars that were set.
Yeah.
And none of that can sit well.
No, you alluded to dread. I think when the anger was an issue, right? Like, I didn't ever let it out at a patient, but internalizing that is not good. The dread that you mentioned, I started picking up on it. I would get in the truck to go to work. It's a 30-minute drive for me because we moved out to the country, to have some peace and fish. But the dread, I would notice my heart rate pick up, and I would notice that you would feel the, adrenaline start surging, and it's not a good feeling. And you get there, and then you start looking at cars around you in traffic, and you're late to work, and you start seeing those as your patients. And I think the biggest thing for me is when I started seeing patients as landmines to avoid. You don't want to pick up this patient who's 40 complaining of tingling and numbness, because it could be anything, right? But it's probably nothing. And you start to see patients not as patients, but as something you need to hopefully not get sued by and avoid. And your memory of patients after a shift are only of the negative interactions, not of, I had several positive interactions with patients, but I don't remember those. You're like you said, your stress levels, not just, but anybody who goes into emergency medicine learns to handle sick patients, and that's not where the stress comes from. That's what we actually thrive on, we enjoy. But that's a small percentage of what we do in the emergency department. So like you said, the demands on you are from lots of patients who don't necessarily need to be there, who are angry for other reasons, but take it out on you. And then, the corporatization of healthcare you have, as a doctor, you're being told what to do, even though you're the expert, by insurance companies, by government, which shouldn't be getting involved, by healthcare corporations, when you have people who are not physicians, who have never practiced in the trenches, who only care about the bottom line. And I don't mean to put down,
Let's be real honest for anyone who doesn't realize this.
Yeah.
There might be one person left who doesn't realize this. Healthcare has become a highly profitable business.
It's a business.
It is profitable for the hospitals. It is profitable for the insurance companies. And it continues to become less profitable for the doctors and the patients.
And even it's exactly what's happened. I mean, it's become a business. Healthcare never should have been a business. It should be a service. And the people who provide that service spend a lot of time and energy to take care of patients, and they should be compensated for it. But what's happened is, for whatever reason, lawyers, not to put down lawyers, but as I see it, this is what I've told friends and family is, I'm sitting at the bottom of a toilet and everyone else is just dropping their crap in on me. Mm-hmm. That's how I started to feel. Right?
And so when you are feeling like that, and I'm hearing you say too, when we're feeling this kind of burnout stuff, you don't feel like you have any control over this stuff.
Right.
People who are intelligent and hardworking would like to be able to say to someone who can fix something, here's what's going on, and it doesn't have to be this way. And yet, 10 years of doing it, it's always this way. We've started to try to say to this person or that person, nothing ever changes. That's all going to contribute to your burnout also, because now I'm just stuck in this bad situation. I can't make a change in it. I think feeling powerless is another contributor to the burnout.
For sure.
Well, I've heard people say this about pretty much any profession. Well, you chose this. And I'm like, no, you don't choose. Like, being a physician, how many years did you spend? 13, 14 years?
Too many.
Yeah. Like, you know what I mean? Like, just preparing to practice as a physician.
Yeah.
Like, and then they're like, oh, well, you chose to be an ER doctor. Like, this is expectation. And I'm like, no, that is not. People can be kind.
Such an excellent point, because the contributing points to burnout, and we can speak on behalf of healthcare workers and physicians, but I think it's everywhere. The contributing points to burnout aren't the things you chose.
Yeah.
Physicians don't say that they are burnt out because people are too sick or because people are dying and interestingly, the lowest amount of physicians burnout are typically not the ones who are working with people who are really sick and dying. It's not the hospice doctors. It's not the oncologists. They're not burning out at the rate that the ER docs and the primary cares are. I think it's important when we look at the things we chose or didn't choose. We didn't choose to fight with electronic medical records, to fight with insurance companies, to want to get things for our patients that we can't get because no one will pay for them on the other end. We didn't choose for people to scream at us because their wait time was long when we were actually seeing 50 other people. I remember
when I worked as a hospitalist prior to coming here. And I remember like literally running, running places to help people.
Then get there and have someone say, you didn't get here fast enough? And you're like, I am sweating and out of breath. I could not have got here faster, but I had other people that I was taking care of. And so I
wouldn't even take the elevator. I would take the steps because it was faster for me to take the steps than to use the elevator.
Yeah. And there are times that stand out to us. I remember in the pandemic when we were testing people in the parking lot and it was 100 degrees
and mass chaos, even though we tried not for it to be.
Of stuff on. And I remember going up to a car where a man and his child were sitting and they were probably scared and may have had COVID, and there was a lot going on for them too. But as I walk up tasting my own sweat, he starts screaming at me because they had to wait in their air-conditioned car longer than he felt was appropriate. And I could not channel enough Jesus in that moment. And in those times, and you can think of a million, every shift, you can think of that. But I think really recognizing how we get to burnout, what those feelings feel like, so that people can start recognizing that I might be on this ride of burnout and really start picking it up earlier, so that there are potential things that we can do. We've talked a lot about really like what is burnout and how to recognize burnout. And it's sounded a little bit through this like, and here's just the nasty rest of your life. However, Sammy has already snuck in the part where he's not on that burnout train anymore, that there are ways and things and ways for us to empower ourselves and take our control of our lives. So please come back for our next episode with Sammy, where we're going to tap into a little bit more of what fields does burnout exist in outside of healthcare, and that there are things we can do. We never like to leave you with a problem that doesn't have a solution. We are doctors. We like to fix things. So please tune in for our next episode on burnout, where we're going to talk about what we can do to help resolve some of these issues. We'd like to leave you on a good note. So here's today's Tell Me Something Good from our clinical manager, Shannon.
So there's a lot of things to be thankful and good for, but I am definitely thankful for my children. My children are my world. I am a single parent. It's hard at times. Work and life balance is very hard to overcome it, and you want to choke them sometimes. But I'm very thankful for my children. They make me smile, and this is why I do what I do, coming to work every day.
Something good is definitely our children, despite the fact that we all want to choke them sometimes. Thanks, Shannon.
Thank you.
Thanks so much for joining us, and we look forward to serving you again next time.